us the best way of dealing with this, the inhalers techniques. What is the best way of doing it? Assuming somebody has no idea what's happening, and I'll give you my cameraman some time to also focus and, as you show us, what is the best way of doing it. And then Dr. Adil will show us how to do it for children.
Yeah. We have various types of inhalers that are in the market, and depending on what the patient has been prescribed on. This one is what we call a meter-dose inhaler, or an MDI, and which is very common in the market. Now we have a tambohera, which is a dry powder inhaler. We have also a discus, also a dry powder inhaler. We have also a hard inhaler. So they have the same concept, but they are used differently. Mm-hmm. So for this one, it's very common that you need to shake it. Shake it.
So the first thing is to shake.
First, shake it.
Okay.
The first thing you shake it, and then you prime it when it is new. When it is new, you just remove it and prime it.
Okay.
And then after that, then you can coordinate breathing in and breathing out, and then you inhale for 10 seconds as it is in. Then you feel the effect of the medication. And then for the people that are not able to use the normal inhaler, we can always use it with a spacer. And you can use a spacer even in an adult. Mm-hmm. In an adult who is a very elderly and cannot have a respiratory effort, you can use a mask and a spacer, where you shake and then you put it in, and then you spray in, and then you breathe for 10 seconds.
Mm-hmm. Okay.
For anybody who is able to use the respirator, you can use it with a mouthpiece.
Okay.
For this one, you can give it not only for what you do for the children, but even for the people with a challenge, like people who have a stroke, the people who have a disability like a facial palsy. You can use it to the mask, because what you need is to ensure that the person has gotten the medication right to the airway to ensure that he is able to breathe. And then there is this one, that you hold it like that. You don't shake it. The MDI, you shake it. Mm-hmm. But for this one, you don't shake it. You just hold it like this, and then you open it like this, and then you twist, and then it gives you a creaking sound, and then you inhale it. So anybody who is using this one has got a respiratory effort. So you have a way that you are able to inhale for 10 seconds. Mm. And then once you finish, you wipe the mouthpiece, and then you close it for the next use. And then you have another dry, which is this one, that is also a dry powder. It's a discus. It's looking very beautiful and very nice. So nobody can know that you're using, because asthma comes with stigma. So you open it like this, and then you pull it down the lever, and then you inhale it for 10 seconds. And then you wipe it there. And every time that you're using the dry powder, or even some of the MDIs, you need to rinse the mouth with water, and then spit it.
Okay.
So that you can remove the powder that is in this thing, because of some of the effects that it can cause. Yeah. Either you can have candidiasis or thrush. Yeah. You can also have dysphonia, which is the hoarseness of the voice. So when you rinse it, you are able to clean up the system, and then later you can take the water.
Okay.
So that is how we use the devices. So different devices are used differently, but with the patient, depending on the patient that you are using, that is what it determines. Because for an elderly person may not be able to use a discus or a tambohera, but may be able to use the other MDI, a meter-dose inhaler, with a spacer. So different categories of people use different ways with the spacers to ensure that you get the proper medication, that it goes and gets the effect into your airway. And then you continue educating the patient or the client on how to use it and how to clean it, because most of the time, because of the infection, we have to do the infection prevention control. So how you clean it, the mouthpiece, because the mouth has never been sterile. So you have to clean it, and then you keep it safe.
Okay.
Yeah.
Dr. Adil, that is in adults now, but Dr.
Yes.
Adil, how do you do it in children?
So I think all of us need to be very clear that when we are dealing with asthma, This is the problem of the pipes of the lungs. We call them trachea and bronchi and bronchioles. So we'll keep it simple and just say the pipes. And the medication that we need to give are inhalers, because the inhaler now goes to the pipes. So I'll demonstrate an adult technique for you to see how complicated this can be. And that's now a doctor showing it to you. So you have to shake, and it can be as simple as this. If you hold this device this way, the medicine stops coming out. And I tell you, Trevor, there are so many people out there who are just spraying this way down. It is this way. If it's not this way, you don't get the medicines out. Okay? So you have to shake. This is now for an adult. Breathe out maximally. I'll just demonstrate and then I'll speak about it. Inhale and hold. And even as I inhaled, I don't know if you saw a little wisp that went up. That even indicated that I didn't do it perfectly. And if I am also making a small 5% mistake, can you imagine children? So because children are not going to be able to do the technique that I've just demonstrated, we shake, we insert it behind here. This is a little bit too small for me because I'm an adult, but my children will tell you I'm probably their age mate. So I put it here. So imagine it's fitting me now. I don't know if the cameraman will be able to focus on the valves there.
He's able to.
But I spray once, and then I breathe 10 times.
Okay.
So let me tell you 3 mistakes our Kenyans are making. Mistake number 1, I'm a child. Spray. So I'm in a hurry. Yes, it needs to be deep and slow. Mistake number 2, our moms want to teach our children how to count. So you put the dawa here and you spray, and then the child decides that I'm going to have a conversation with Trevor. Trevor, you know what? I went and I saw you yesterday. And then, so you're supposed to be breathing silently and deeply.
So no talking.
And no talking. So deep breaths, and that's how you do it. So you shake, spray, and you breathe 10 times. If the doctor says you want a second puff, shake again and repeat the cycle again.
At what intervals is this done, Dr. Adil?
So if the doctor says you want to do 2 puffs, so you'll do 1 and then breathe 10 times, and then you can wait like a couple of seconds, maybe 5-10 seconds, to give the child a bit of a breather. You know our children, Trevor, they're all over the place. You can't keep them here. So give them 5-10 seconds and then bring them back and then carry on with the next puff. So it's pretty much back to back. You don't have to wait too long before you do one to the other.
So is this twice in a day, once in a day?
So sometimes the doctor will say, sometimes the doctor will suggest that you take it once in a day. Most of the inhalers that we have to treat asthma are steroid inhalers. Okay, and most of the time they're given once in a day. There'll be times when the child or the adult is also a little bit sicker, and that you have to do it twice in a day. And you know, I've used the word steroid, and that will send a little tiny shiver down every parent who's listening to me right now. I want to reassure you, Trevor, that when we're talking about asthma care, be it for children and adults, this is now across the board for the panelists who are here today, a steroid inhaler is a safe medication. What the parents, sorry, I'll refer to parents most of the time, what they need to really be worried about is the syrups and the tablets of steroids that we are swallowing in our Kenyan community. Those are medicines like prednisone. Those are medicines that you need to try and avoid at all costs. If Dr. Buika gives it to you, that's fine, we understand, he's at his level, etc. But for the parent out there, I want you to know that when you're spraying a steroid inhaler, 1 puff, once in a day, you're giving 1 over 1,000 the amount of medication than if I took the pill. And that statement and that number, I'm not here to complicate life for the Kenyan listening to me right now, but we need to understand that when you're using a steroid inhaler, you're using microscopic amounts of steroid that only go to your chest. They do not go to the rest of your body, and so they do not cause side effects. And right now what is happening in Kenya is everyone is drinking the steroid, so we're having the steroid permeate our entire body. So now we're going to get diabetes and blood pressure problems and sugar levels. And the parent who fears steroids, that's the one you need to fear. The drinking, swallowing steroid. That's the one, Trevor. Don't go down that road.
Okay. Dr. Buika, how do you know, and how then do you control asthma? Because it's interesting.